Good morning, Beth. How are you?
I am well. How are you?
I'm doing great.
Good.
So glad to have you here today, and I'm really looking forward to the next 60 minutes, which I'm sure is going to be a very engaging conversation.
Thank you.
So Beth, to kick things off, maybe you could tell us a little bit about Chime, its
Sure.
mission, and your role at Chime.
Sure. So, Chime is a challenger bank. So, we're an online bank that really tries to appeal to our members who are not necessarily the popular members of many other banks. So, we don't charge any fees. We really strive not to take advantage of our customers, but to make sure we are figuring out ways to support our members and doing that by having education for our members and really trying to support their financial acumen and freedom. And so Chime's been around for many years and has been growing significantly over the last 2 to 3 years, and developing more products and services to really make sure that we're serving our members. My role is to head up people and talent. So head up our recruiting function as well as what is traditionally called HR, which I like to refer to as people. So it's my honor to support a team of we're about 35 people in total in hiring and making sure that our organization is set up to succeed and putting in programs and practices to really help support people in doing their best work.
Oh, that's so great. So, is how distributed is the team at Chime?
Well, now we're very distributed, but until that time, until, we started working from home, we were pretty much a company that was an in-office company. The majority of our operations are in San Francisco, and we also recently, within the last year, opened up an office in Chicago.
Okay.
So those are our two primary locations, and it's really a new dynamic for us to be working in a distributed way.
Yeah, and being in the financial industry, does that put any extra constraints around being distributed in any form?
There are some regulatory constraints that we have. Luckily, we've been able to work through those constraints in a productive way. And, we've really had to adjust in so many ways, both with our internal employees, as well as a lot of our external employees who support our businesses from different locations. So it's certainly been a big change and challenge for our company.
Absolutely, and we see that every day, and we were chatting a little while ago, but it's becoming the new normal.
Yes.
So I want to kind of switch gears and talk about what's on top of everyone's mind, COVID-19 and the impact. So maybe Beth, you could give us a sense of every company had to adapt to this new situation.
Mm-hmm.
So in terms of on the people side at Chime, how have the Chimers adopted, and what are some of the things you've taken care of?
Yeah. So, I mean, as I said, we were really a in-person, face-to-face company.
Yeah.
We didn't have many remote employees. We didn't really have a distributed workforce. So we had to completely change everything and really adapt a new way of working. I would say that we are still working on how we're going to work best during this. I think we've adapted quite well in terms of bringing a lot of things that we did in the office to being remote, but some of those practices we're having to really think through and change. So for example, because we were a very in-person, face-to-face, meeting-centric company, it's meant that many of us are spending a lot of time in Zoom meetings. And that has certainly been, I think, trying for many people. It's we were talking about this earlier, but I think there is some sort of, dynamic that is draining for people being on camera all day long. And so it's given us the impetus to really look at the way that we work together and figure out how we can actually use this to our advantage in adopting new ways to work. So, for example, trying to figure out, can we use more written communication and have discipline around, sharing things in advance, being clear about who's making decisions, who's responsible for things. And we're hoping to test a few things in the next coming weeks and months to see how that changes the work dynamic for everyone. I would say for leaders, there's been a lot of change and challenge. Again, for myself, every morning I would, go over to talk to my team and spend time with them in the morning. Many of us were very early to the office. And so that's the way that we connected and engaged with one another. And we've had to change that. We can't be in person anymore. So we are trying to do things like, keep connected through different, Zoom meetings, on Slack, share different things. And so we've had to be really intentional about how we stay connected as a company and as teams.
Absolutely. And you bring up a very important point, and that is, water cooler conversations were so big part of how we interacted, and that's not there anymore. And so what is in lieu of the water cooler conversation? So I think, absolutely. I think ideas like in one of the clients I was talking to, basically they make sure that they have a virtual water cooler set up on Zoom every day. And in fact, they make sure that there's like one of them has like a water cooler in the background just to give that extra effect. Small steps, but I think goes a very long way, essentially. Yeah. So what do you say, Beth, that in terms of some of the challenges of setting it up? So I think we are probably a month now into this new situation.
A little bit more. I would say we started working from home probably the second week of March. So we've been going for almost 2 months now.
Almost 2 months now, actually. Yeah, time does fly by. Yeah. So now, if you look at where you were a couple of months back when it started to where you are now, I'm sure you had some learnings along the way.
Yes.
Would you like to share some of that?
Yeah, I mean, I think it's gotten easier for most people over the last 2 months. I think in the beginning, there was so much uncertainty, not only in terms of how we were going to work, but the world situation. Parents were especially empathetic to parents right now who are having to manage the schedule and homeschooling in addition to work. And so I think we have figured out some strategies to try to evolve. And those are things like making sure that we are allowing parents to augment their schedules to work for their families. And, for many of our leaders, including, many of our senior leaders, that might mean that they're not going to be online in the morning. And that's their time to spend with their children and get them set up. And then perhaps they switch with their spouse in the afternoon. And so, we're trying to make that a normal for people, that we are able to manage schedules that way. I also think in the beginning, perhaps in an attempt to really make sure we're being connected, we were almost adding too many things to people's calendar. We were doing check-ins and group check-ins and one-on-one check-ins. And, I think it was the right thing to do at the time, but I think now we've gone into a little bit of a better cadence with that, because I'm sensitive to putting more things on people's calendars. And so I think it's become a real balance of staying connected, but not overloading people and making people feel like, the connectedness is just another thing that they have to do. So I think that will continue to evolve. We're also, as a leadership team, trying to reach out to everyone at the company on a regular basis. We've been doing video updates from our leadership team every week, where a different leader will give an update to the company. We're continuing our all hands, and those have actually, we never have had 300 plus people online before, and they've gone actually surprisingly well. We also have a ritual called show and tell, where we highlight work every Friday, and we've moved that online, and that's, it's becoming more normal for us now.
Absolutely. And you bring up really two great points. One is I think when we started the process of moving online, we tried to kind of mimic almost the face-to-face situation online, getting everyone connected so much. But I think we figured out what the right balance is now,
Yeah.
where, like you're right about kind of creating blocks of time when parents are not available, right? So you
Right.
kind of plan around that. I
That's
think the
right.
second important part you also bring up, Beth, is around modeling the right behavior for
Right.
everyone, right? And I'm hearing a lot of that coming from leaders at Chime, which is so
Yeah,
great to hear.
we're trying. And I think one thing that we've been really trying to be sensitive to is letting people know that, this is not just us moving to work from home. This is working from home during a global pandemic. And no one, no one's written that playbook. Nobody really knows what to do. And so I think we are trying to just use our values as we think through it. And one of our values is to be human. And that's really, for me, the rubric that I've used in approaching all of this. And I do think it is important for our leaders to role model what we want. So, for example, if we're telling people this is a marathon, not a sprint, and we're telling people, please take time off, but none of us are doing that, I think it is, a difficult dynamic because, employees are wondering, is that really authentic? And so, it is great that the leadership team has been doing that and trying to model the behavior that we really want to happen within the company.
Yeah. So I think that also brings up another point around expectation on productivity.
Yeah.
I think so that is on top of everyone's mind, is that, okay, we're virtual, we're set up, seems like we're connected, we can do as much work. What have you been hearing, Beth, around, from managers or people leaders around productivity and some things around it?
Yeah, I mean, I think we're still working through it, honestly. We are trying very hard to focus our work and to be mindful that perhaps all the OKRs and objectives that we set in the beginning of the year may not be possible now. And so, we are trying to augment those as necessary. One of my team OKRs got augmented, and I think it was a relief for people. It's an interesting dynamic because, my company is very mission driven, and much of the work, all of the work, is really in service of our members. And so I think it's a real balance for people really wanting to do the best for our members, but also be mindful of their own mental health and their own self-care. And so, I don't know that I've seen productivity go down. I don't have any data that suggests that is happening. I do think that people are being open in many occasions when they feel like they need a break or they need something augmented in terms of their own OKRs or objectives. And so I think it's just going to continue over the next couple months for us to figure out how we balance that productivity and moving the company's objectives forward while not burning our people out. And I keep saying, and I think it resonates with the leadership team, I don't want a bunch of broken people coming back to Chime. And I do think we're at real risk, not Chime specifically, but in general. I do think we are at risk of that for sure if we are pushing people too hard during this time period.
Very true. And it's a very nice reframing, saying that, okay, this is a pandemic and we're trying to work while there is a pandemic.
That's right.
So I think, what I've been hearing with my clients during coaching is also understanding that productivity, it probably may look different, right?
That's right.
And then understanding that and actually modeling it is so important. So how do you, Beth, keep a pulse on, employee morale and other metrics right now?
Yeah, so a lot of ways. I frequently check in with people all the time. I just Slack them and ask simply how they are. And I think it is important that we do that. And the rest of the leadership team has done that as well. I would say most people say they're fine. Some people have said they're not fine. And it's given us the ability to try to help strategize what we can do to make sure they are getting what they need to feel productive and feel like they're taking care of themselves.
Yeah.
We also just launched a pulse survey. Usually we would do a broader engagement survey during this time period, but we decided to wait. I thought it would perhaps, we might get more false positives, false negatives if we launched it now, but we did a simple survey that talked about, the response around COVID, as well as how we are communicating and collaborating together. So that data will be coming soon. And then we've also done things, I have one today, just to check in with people managers to see how they're doing and to make sure that they are getting the support that they need to check in with their teams in a way that they feel good about. So we're doing a lot of different things to get the data, and I think that has to continue. And I think our employees need to continue to see that their mental and physical well-being is the most important thing to the company right now.
Yep, absolutely. And, check-ins are so important. Even research says that sending out just a simple care message that, how are you doing? It has such a important effect on mental health.
That's right.
Right. And I think the thing with check-ins also as a ritual is, I think when we are face-to-face, you had the leeway of, maybe skipping a couple of times, but, you would bump into somebody in the hallway and at least get that covered. We've lost that luxury now. And I think
exactly
maintaining the rigor is so important. I know you're a coach too,
yes.
Beth, right? And I'm a coach too, so I have to ask a coaching question. What would you say in this, just around, people adopting and adapting to the new work, to the new reality? What is the unique role of a coach today?
Yeah. I mean, I think, coaching is so critical for leaders. And I think how I see coaching being very, very useful right now and always is, I think for a lot of people under times of stress, they may revert to behavior that they're very comfortable with, even though that behavior may not be the most productive behavior. And so I think having coaching right now and having access to a coach right now can really help people be self-aware when they might be, going to the dark side of their personality because the stress is so high. I also think that it is critical for leaders to understand how they're actually doing themselves. And oftentimes, we're responsible for holding up everybody else and we don't take care of ourselves. And so I think having a coach that can help you with strategies around how you take care of yourself so you can be strong for others is critical. I had a coach tell me one time, you have to put your oxygen mask on first. And I think that is very true right now. And I think it's sometimes very hard for leaders to do. But I think, I've told our employees that are going through a coaching program that we have, be a little selfish right now in terms of how you can develop yourself, because that is going to pay off dividends to the company and to our employees long term.
Yeah, I love the oxygen mask metaphor so much, right? I mean, you just kind of vividly realize what it is. Yeah. So I do hold weekly sessions for our coaches just to kind of get a pulse of what they're hearing. I think one of the most important things I'm hearing for the last few weeks is coaches telling their clients it's okay. Yes. Right? And just realizing it's okay, I think goes a long way. And I think what you're saying really totally resonates with that.
Yes, I think it's easier said than done, but we really have to practice it ourselves. We do.
Yeah, absolutely. Let's talk a little bit on the mental side of the equation, mental health side of the equation now. So you did talk about the Chime value of be human a little while ago. Could you speak a little bit more to that? I'm sure everyone would love to hear.
Yeah, I think, the value is really twofold. It is about how we treat our members, in trying to be empathetic and understanding of their, their own personal situations. And that also applies internally. And so how we like to approach things at Chime is really thinking about how that impacts the person, and what we can do to make sure that any decision that's made, that it's approached in an empathetic and kind way, even if it's a difficult decision to make. And so, that has really, I think, been a critical value for people to pull to during this time period. And, for me, I think, I've been doing this job for a very long time. And I think, the role has evolved tremendously. And I think how we think about how we take care of our employees over time has changed tremendously. I think, in technology in Silicon Valley specifically, there's been such an emphasis on giving people things, giving people free food and, games and happy hours and all of those things. And while those things are not bad things, and I don't think anyone's going to turn those things down, I don't think they're sufficient. And how I really like to think about how we're going to care for our employees long term is to think about things like having great leadership, having people take care of their physical health and wellness, their mental health and wellness, and their financial health and wellness. So for me, those are really the three pillars that I look to in terms of how we actually make sure we have a, productive and happy workforce long-term for the company.
Yeah, and it's such an amazing mission, and it's so well worded, I would say, right? And the value itself is so well worded. Even in modern health, we talk about like the holistic well-being of an individual, right? And I think exactly seems to be the thought on the same lines. I was reading a very interesting article the other day around the whole concept of ROI being return on individual. And yeah, it was a very great concept to talk about and say that, think about return on individual. And you just mentioned something very interesting about, doing the right things, right? You want to do it not because you're kind of measuring profitability, but because it's the right thing to focus on the individual. And, the article goes to talk about how it impacts in families and then the company and then even the society as a whole. And it's interesting, very interesting model. So in terms of mental health discussions within the company, Beth, so what are some of the avenues for you to have those kind of discussions? Could you speak a little bit to that?
Yeah, I mean, I think prior to COVID, we had been, putting in modern health as a tool within the company. And I think, for me personally, I have seen the evolution of mental health in the workforce change significantly over the past, 5 or 6 years. I think 5 or 6 years ago, you would have never had that conversation at work. It would have been very taboo for someone to bring it up, unfortunately. And I think most companies, did what they could. They put in an EAP plan and, tried to do their best, but there was not a lot of other venues or products or services to try to address mental health in the workplace, or in general. Luckily, I think that's evolved a lot. And I think it's evolved for a number of reasons. I think, people in the public eye being much more open about their own challenges with mental health. And I think that has really been critical in trying to change people's minds that may have, thought this was something that was going to be something that would stigmatize them into something that was really known as, a ubiquitous issue across, the workforce. And so we have, tried to be open about it. I think we still have a long way to go, as I think most companies do. We have had multiple sessions around taking care of yourself with Modern Health, in conjunction with Modern Health. As I said, we rolled out the Modern Health to the company, luckily our timing was quite good because we were going for an implementation at the end of March.
Mhm.
And so our timing was actually quite perfect because of the COVID situation. And so, I think we're just trying to be open about it. We're trying to make sure that people understand that there are services and support for them, and, not closing our eyes to the reality of the situations that people are going through right now.
Absolutely. And when I talk to coaches, etc., I think they also talk about a lot of clients coming to the sessions now, obviously curious about the process and what they would get, but there is a real need now that they feel, and there's a sense of urgency too. And I totally agree that having that support system in place, whatever that support system may be, I think gives a great level of comfort to every employee at the company, essentially.
I think so.
So as you have these, conversations on mental health, and as you've rolled out these policies, what have you found to be the most effective? So I'm sure a lot of people managers are on this call listening.
Mhm.
Would you have something to share in terms of what's the most effective way of either rolling these out or
Yeah,
disseminating?
I think there's multiple. I think you have to do it in multiple ways. We have done, announcements to the whole company. We've done things by department. We've reached out to people individually. So I do think it has to be a multi-pronged approach,
Right.
in terms of communicating and making sure people understand what is being offered for them and how it can support them. And so, again, I think the most important thing is for people to understand it is okay. And, we are putting these things in place, not because these are issues that come up once in a while, that these are issues that come up all the time, and to many, many people, and to people of all different levels and ages and backgrounds. And so I really think the most important thing is the message that this is okay, and we want you to get the support that you need, and we want you to be as open as you feel like you can be with your manager or with people at work about what we can do, to support you and what you need. And so I really think, again, I go back to our value of be human. I really think that, you just have to understand where people are and try to meet them where they are.
Yeah, absolutely. And I think there's a part around, you're totally right about, people feeling it's okay to kind of reach out for help. I think that's the important piece. For example, this month is Mental Health Awareness Month.
Right.
And at Modern Health, for example, we have an entire month of challenge. The goal of the challenge is not to have activities, so you put another thing on everyone's calendar for them to do. The goal is to actually create a very structured environment where they feel a psychologically safe space to do activities, which helps their mental health. And I agree that it has to be a multi-pronged approach. I totally agree. And then meet them really where they are. I want to switch gears again a little bit and talk about one of the most important aspects of mental health, and that is self-care.
Yes.
So Beth, you have a lot of things on your plate to manage, especially in this environment. How do you take care of your own self, and what are you recommending to your own people managers?
Yeah, well, it's interesting that you say that, because I actually this morning just sent a note to my amazing assistant Meredith that said I need to figure out a way to clear my calendar a little bit. I stopped
Yeah,
working at 10 o'clock last night, and that's not, that is not a sustainable mode for
absolutely.
anyone. And so I
Right.
think really trying to be honest about with myself and others about where I am and what I need. And I think that's sometimes hard for a leader to do. Because I think, many leaders feel like they almost have to be superhuman. And we're not superhuman. We're people too. And so I think for me, I'm trying to do that. I have to say that, exercise has been absolutely critical for me, always, but right now it's just been such a gift to be able to, spend an hour or more a day exercising. It's been absolutely critical for my stress management. I also am trying to make sure I'm getting enough sleep, which, for me personally, I can really tell when I go through, a period where I'm not sleeping, how much it impacts my own demeanor, and even the way that I treat others, I think changes. So I always have to be mindful of that. And then I think just trying to really understand and spend time with myself, trying to understand what I need to do differently in terms of how I navigate the situation, which is a hard situation for me to navigate, as well. So those are the things that I'm trying to do. I can say I'm, not always perfect in it, and I have to check myself like everybody else does. And luckily I have, a coach that I work with who will check me for me if I'm not checking myself. And that's been, truly critical for me at this time period.
Absolutely. I'm sure there are a lot of people managers on the call. You're like, okay, I need to make sure my team is okay. And, and if that leads me to sacrifice my own self-care, I'm going to take care of it later, right? What would you want to tell them right now?
I would say, I can't say that I have not done that myself. I have. Yeah. I am extremely lucky that my senior team will tell me, you've got to get offline. You've got to go take care of yourself. And they're so great that I really don't have to worry that things are not getting done. And so what I would say to those people leaders is, a couple things.
Mm-hmm.
Why are you doing this? Is it really necessary that you are online all the time? Is there something more going on for you that you feel like you have to do that, and perhaps you're not delegating enough to your team? And then really trying to get in touch with how you're going to keep this up long term. Which I think is an important thing to think about. We may be working from home for months. It's really hard to say right now. And I think, people need to get into a new normal and a new cadence of working. And if you're constantly on all the time, at some point, in my opinion, that will likely backfire for you. So I think about long-term and not just, short-term impact of what you're doing.
Yeah, and one of the conversations I had with one of my clients was on the similar lines, where he said, I think my team is taken care of well, but I have to do these things. And I was kind of wondering, if you don't model the right behavior, maybe your team is not feeling quite well, right? So they probably, right? And they may not be telling you because they may not feel that you're approachable about these issues.
That's right. I mean, I think there's a book that I read, The Knowing Doing Gap, and I think this is what's going on for a lot of people right now, that they know that what the right thing to do is, but they're not doing it. And I do think that that gives a message to your team and to the broader team that if you're not giving yourself license to take care of yourself, are you really being genuine and authentic when you're messaging to the whole company that they need to do that? So, I think it is a very hard time for leaders. And I think that, for many people, this is going to improve their leadership skills tremendously, because they're going to have to adapt, and they're going to have to be self-aware and really dig deep around, how they're going to lead. And I think for others, it may, be the opposite, and they may, go into a mode where they're feeling destructive about their own leadership. So, I think it's going to be it's just a very interesting time to be a people leader right now.
So true. And that, that reminds me of a conversation I had with a people leader who said, I think I was doing a great job, and now this is all before COVID-19, right? So, and now, she told me that I didn't realize so much of this was demanded of me, right? So I think a lot of the things demanded of a people leader, where in normal times, you could sometimes get by not having to exert it so much. I think it's come to the fore so much that I think for some of them, it's becoming an issue of, okay, am I doing the right thing or no on a constant daily basis? Anyways.
Yeah, it is. Yeah, I agree.
I think, as you said, Beth, this could last for a few months. We don't know really how long it's going to be.
Mhm.
So as, people managers and people leaders, as they think about what do they need to put in place for the next few months, etc., what are some of the things that you're doing at Chime or thinking about at Chime?
Yeah.
If you could speak to that.
Yeah, so I think, for me, what we're really thinking through is kind of the more structure around things, the better. So as I mentioned, trying to make sure that we're being really clear about, expectations, making sure that we're not overloading people, putting in systems and processes for people to communicate and collaborate
Yeah.
in better ways. And then I think also just making sure that from a leadership perspective, that we are keeping up with the, the check-ins with people and making sure that we are really trying to lead the organization in a sustainable way, and thinking about the long term. So, again, it's going to be trying and challenging. Nobody has a playbook for any of this, and we don't know how long it's going to be. We don't really know, when and if we go back to the office, things are likely going to change, in terms of how many people can be there and how we can interact with one another. And so I really think it's a time to challenge ourselves in really what is the right way to work and an effective way to work, which may be very different than it was 6 months ago.
Yeah, and also it's very true. And I think about time is, if you just wait for it all to be over and say, okay, things are going to be back to normal. The problem with that is, the time you're spending waiting is actually has a reverse negative effect on you. Sort of
That's
it, right?
right. That's right.
Yeah.
I do think that a lot of good will come out of this, actually. I think about for my company, we didn't have a distributed workforce before. We didn't know, we're a company with a lot of, people who are new to leading. And I think now we will see that we are going to be capable of that, which I think is a great muscle to be able to have in this, very competitive talent market. I think we're learning to be more intentional with our decision making and communication. I think that will benefit us. So I do think there are a lot of positive changes that I anticipate we'll see in companies over time because of this.
Absolutely. It's a big human experiment, isn't it?
It is.
Of unprecedented scale.
That's
And I was
right.
reading an article last week. I think there was probably a CEO of Barclays, etc., who said, you
Mhm.
know, we may never go back to having, real estate and managing, because I think this may just work out. And, yeah, you're right. Absolutely. Right. There could be a new normal that emerges from this. And I think all for the better in how we,
Yeah,
act.
I agree. I agree. It's going to be interesting. I mean, and again, I don't think anybody knows, right? No one really knows what's going to happen. And I do think that element for a lot of employees of the unknown and being in limbo is very, very difficult. And I think from a communication perspective, trying to communicate as much as possible is critical, even when you may not have all the answers right now.
Got it. Yeah. So before we turn it over to a Q&A, I just had one question for you, Beth. So throughout this process, I know you worked through a lot of challenges, you've learned a lot of things. Um, what is one thing that pleasantly surprised you, if there was any?
I think I was pleasantly surprised with how adaptable my team was. We obviously hire a lot of people, and we do that face to face and onboard people face to face, and we had to really quickly completely change everything that we were doing to be remote. And I could not believe how quickly and effectively the people and talent team moved to be able to do that. And it just demonstrated how innovative and agile people are, even though perhaps they may not even realize that. And it's been really impressive for me to watch the team evolve in such a fast and effective way.
Yeah, I can just feel the energy just when you say it. And
Yeah,
it's
I'm
really
quite proud of my team, as you can tell.
amazing. That's so right. Yeah, I think we'll probably turn into Q&A now and see, Michael, you probably have questions coming in.
All right, great. Thank you both. That was such a good session. Thank you, Beth, for sharing all of what you're doing right now for Chime and for everyone. So we've got a couple of questions coming in. What I'll do right now is I'll read off a couple of the questions and then toss it to Sanil and Beth to answer. So the first one that came in was a question for Beth and a question around company values. And it says, do you think that there will be a permanent shift or evolution to company values even post-COVID?
Yeah, I mean, that's a really interesting question. I think it will cause leaders to examine if their values are actually being used in the way that they should be, and that is to create kind of guardrails and being used for decision making and being used in a way that is authentic and real versus just having them written in a guidebook or shown once at employee onboarding. And so I do think perhaps for companies that are self-reflective, they may be examining those values and perhaps augmenting them to be values that are really going to serve the company. I would say for Chime, I believe our values are serving us very well right now. And, if they were not, I think we would be hopefully self-reflective enough to change them. But I could see there being changes coming up with company values. I think it's an interesting question.
Yeah, I totally agree with you. And, one of our leaders at Modern Health made this statement once. He said, like, values are something you do even if other things happen, right? I think these are times when those even if parts have been tested. And I think, yeah, absolutely right, that, we'll come up with values which have been battle tested, I would say, if you will, or modified to kind of suit, the new reality.
Yeah, I agree.
Perfect, thank you. So the next question is actually about modern health and mental health services. So maybe Sanil, you can begin, and then Beth, you can talk about how Chime is using it. So the question is, for those of us who are less familiar with modern health, Sanil, can you give us a quick overview of what the care services and model is? And then Beth, perhaps you can speak to how Chime is using modern health right now, or any other behavioral health services.
Absolutely. So Modern Health partners with employees to provide mental health benefits to all the employees. And what that really means is that an employee could really use either the digital content that's on a platform, or they could be connected with a coach, or they could avail of they could be connected with a therapist for therapy services. So it is an end-to-end holistic mental health platform that can meet any employee where they are. And that's our model for providing care. And one of the major value propositions we have is to kind of get easy access to care when you need it in a timely fashion, without a lot of friction that you would go through in a normal insurance situation. Beth, I'll hand it over to you.
So I looked at a lot of different behavioral health solutions before I decided to use Modern Health within Chime. And I think, how we're using it is all of our employees can access the digital content, which is, meditation and stress management. It's very easy to access. It's, on your phone, so it's where most people are using things a lot. And then all of our employees also get access to coaching sessions and, if needed, therapy sessions. And for me, I think what I really like about it is it does give people access to both. Not every situation needs a therapist, and sometimes a coach can be extremely helpful and useful. That is not the case in all cases. And so it gives people flexibility to use both modalities. And I think for me as a leader, it also gives me data around what's going on in the workforce. So there's anonymized data around what are the areas that are really impacting my team. And, things like stress and anxiety are certainly up at this time. And having that information and that data has been really important to me in making sure we're trying to do the right things for our Chimers.
Perfect, thank you. The next question is around L&D programs, and it says, have you changed any of your L&D programs and options during this time?
Yeah, that's a great question. And I think we were implementing 2 programs prior to COVID. And one of them was a program for first line leaders that encompassed, some feedback and some modules around basics of leadership and a coaching element as well. And then a completely other coaching program for more senior leaders. And so we have just adopted those things to be virtual. The coaching was an easy one because it was already a program or a company that was doing virtual coaching. But on the leadership development program, that was supposed to be a lot of it face-to-face, and we are just adapting. And so, we thought a lot about this as a team. Should we pause or should we continue? And I felt very strongly that we needed to continue. And now more than ever, it is critical that we give people the support to be the best leaders they can be. And so I personally believe it is a great time to try to innovate around leadership development because we really need it right now. And so that's what we're doing. We're pretty new into the implementation of it. I'm optimistic, but I'll certainly get more data in the next couple months around how it's working.
Perfect, thank you. The next question is around the balance of family, personal, and work. So it says, as a manager, I'm currently feeling stretched taking care of my team and their needs while also balancing my family and my personal needs. What should I do to help meet everyone's needs right now?
I mean, I think that is a very common thing that's happening right now. And I think it's courageous to actually admit that, because I think many people are not admitting that to themselves. And, I think there's a couple things. I think if you can, and hopefully you can, please express that to someone, to your manager, to hopefully you can talk to your manager or a coworker, to try to make sure that they understand where you are, because all of those parts of your life are critical, and it's important that you spend time in all of those areas. So you may have to shift some things right now. You may have to declare that you are blocking off your calendar at certain time periods. You may have to change some of the practices of the way that you work. And so I would really encourage you to think up some strategies and go to your manager and try to figure out how they can help support you through this. And they may not know how much you're struggling. And I think, we can't assume people understand where we are unless we tell people where we are.
Yeah, I so agree. And I'll bring back to what Beth, you mentioned earlier, that we are in a pandemic and we are trying to work through a pandemic, right? So I think speaking to somebody about it and being okay with, not everything being in balance and managed is, I think, very important. And again, also go back to something else that Beth mentioned is around, make sure you're putting on your own oxygen mask, because that's going to be so important.
Yeah, I think I'm reflecting on something I saw posted somewhere that said, we're in a global pandemic, not a productivity contest. And I think sometimes, even myself, I have to remind myself of that.
Yeah, absolutely. Especially as the work hours get blended, it's so important to keep that in mind and make sure that we're taking care of ourselves and our teams, and our families as well, and our teams. So the next question is, how is your team and company preparing to go back to the office after COVID?
Yeah, so we are actually still talking through that. And, we have a subcommittee within our company that is working on a plan, and that includes, someone from my team, someone from workplace and real estate, our risk team. A lot of different groups are involved in this, and we are really trying to balance what is going to be best for our community and what is going to be best for our employees. And you know, we are getting plans in place around how we can go back, knowing that, you know, from a very kind of unselfish perspective, we can work at home and we are able to, and not everybody has the luxury of that. And, you know, we are thinking about, you know, should we not be crowding BART and buses and using resources that other people may need more than we do right now? And so we're really trying to balance that, and also balance, you know, I'm okay working at home. I've got a pretty big space. You know, it's not that uncomfortable for me. We have many employees that are living with 3 and 4 roommates, and it's not as great of an experience. So, you know, we are still talking through it all. We have a lot of plans in place of how we're going to do it. I think when we're going to do it is an unknown right now.
And then maybe 1 or 2 more questions. So this next one that I see is around engaging people in conversation around the mental health. So the question is, what are questions that I can ask my team about their mental health to check in to see how they are doing without sounding invasive?
Yeah, it's a great question. I don't know, Sanil, do you want to take that first, or do you?
You can go ahead and then I'll chime in. Yeah.
Honestly, I think I feel, again, very grateful that I'm quite close to my direct reports. At least I think I am. And so I think they're very honest with me. But I ask people simply, how are you? Are you okay? You know, is there anything I can do to support you? And I think over time, if there's trust built, people will open up with those simple questions. I think if you know there's more going on for someone, I often will say, you know, have you accessed some of the resources that you can access to take care of yourself? So those are just some of the very simple things that I'm doing, and Sanil may have some better questions for you to ask.
No, I think those are absolutely right. And I would add on to that is that I think it's important to show the intention and be authentic that you really care. And I think that's very important. The second part is to follow that up by actually being present and being approachable and being available. Right. Yes. I think, you know, you ask the right questions, and if you're available, you'll find that, as Beth mentioned, you know, they will open up and they'll kind of come to you with the right help that they need.
Yeah. And I think also, you know, I think the authentic comment is a great one. I think, you know, honestly, people need to truly believe that you care about them more as a person than you do about them as a work product, right? And people can tell if you really believe that or not. And I do believe that. And I want my team to feel healthy and productive and that they're doing meaningful work.
Yeah, absolutely.
Perfect. And then why don't we end the last question on a positive note, and just for each of you to just share a positive story or anecdote about how people have been interacting either at your company or with your products.
Wow. I mean, there's so many. I mean, we have been able as a company to give people access to their stimulus money early, which has been absolutely amazing. And so we are really trying to make sure that we're giving our members everything they need to understand what is available to them. So that has been extremely meaningful to the company in terms of our mission. And I think, you know, that also has been reflected in how I see employees treating one another. You know, I do really see people holding each other up and caring for one another during this time period, which has been extremely gratifying for me to watch.
And I think on my side, I would say, you know, one of our coaches mentioned that, a modern health coach who mentioned that one of the clients came and said, you know, she's been coaching for a while, but she said, I just want to be able to talk and just thank you for being here and so easily accessible, right? So I think that simple sentence has so much in it. And I think that those are the moments that we live for, I think.
Yeah.
Yeah. Well, thank you two so much. It's so great to hear both of your points of views, and thanks again for taking care of all of us, Beth and Sanil, and everything that you're doing. So for those who are still on the line, we'll send out a recording of this to your email address after this, so you have a copy of it. We'll also be sharing out Beth and Chime's customer story, so how they've been engaging their employees with mental health as well as with modern health. So you'll be able to read that through and share it out. And then for those looking forward, we're going to have another one of these fireside chats next week with Twitter's Global Head of Benefits. So look out for that sign up link as well. It'll be next Thursday, May 14th. So Beth, Sanil, and everyone else who's on the line, thank you again. We're so appreciative of your time, and we'll talk all soon.
Thank you so much.
Thank you, Beth.
Bye.
Bye. Take care.